list of infectious diseases. The goal of these lectures will be a general awareness of different kind of infections and also the treatment of different important common infections. Uh, Today we are going to talk about MRSA. MRSA is a type of Staphylococcus aureus infection which is resistant to a medication called methicillin, uh, hence the name methicillin resistant Staphylococcus aureus. Uh, MRSA is an aggressive organism and sometimes can lead to fatal infections. Therefore, immediate recognition as well as treatment is necessary. Uh, Sometimes patients are colonized with this infection and usually have nasal state of carrier. Mm, it's treated with an ointment called as Bactroban or Mupirocin, uh, and it's very important to eradicate the nasal carrier state because it may cause invasive infection at the time patients are patient's immunity is low, uh, or during stress when body's resistance is low. Um, Usually, if patients get MRSA infection of the skin or soft tissues and patient presence in medical office, the treatment can be done with an oral antibiotic, and there are different types of oral antibiotics that are available for MRSA skin and wound infections. These include Bactrim, uh, which is a sulfur product and should be avoided in patients who are allergic to sulfur antibiotics. So history is very important while treating this kind of infection or while using the Bactrim. Um, the dose which we commonly use for acute pharyngitis uh, is actually not the dose for MRSA infection, where we use higher doses such as Bactrim double strength tablet. Instead of one twice a day, we use it two tablets or three tablets, two tablets twice a day or two tablets three times a day. Uh, Also, patients who are given Bactrim as an outpatient, it's important to advise them that they should be drinking plenty of water because sometimes it forms crystals inside the tiny tubules of the kidneys and may precipitate their causing kidney problems. The second side effect that can be severe and can be serious is bone marrow suppression. So if the treatment is used for more than a week, then it's important to monitor both the renal functions as well as CBC or the bone marrow function. Second medication that's commonly used for treatment of MRSA infection as outpatient is clindamycin. Uh, the dose is 300 milligrams twice a day, and clindamycin is associated with a higher risk for C. diff colitis, which is a condition that causes diarrhea and may have serious and may produce serious illness in the patient. So beware of C. diff while using the clindamycin. The third antibiotic that's used for uh, for outpatient therapy of MRSA is doxycycline or vibramycin. The dose is 100 milligrams twice a day. Uh, Patients should be advised that it may cause photosensitive rash, and therefore the patients should avoid sunlight exposure while they are on doxycycline. Doxycycline may also really cause hepatotoxicity, and the liver enzymes may get elevated while a person is on doxycycline. Other antibiotics which are oral are linezolid or Zyvox. This is a very expensive antibiotic, and a week's course may be $1,500 or so. It's used as a second line because of its cost. Linezolid can be used for skin and soft tissue infections as well as more invasive infections. The side effects of linezolid that patients and the clinicians should know is linezolid may cause elevation of the blood pressure when it's combined with tyramine containing diet. So patients should be on tyramine free diet, and it may also have interactions with certain antidepressants and may cause blood pressure elevation. So if the patient is on any antidepressants or psychiatric medications, you should check for the drug-to-drug interaction before using linezolid. Also, it's very important to know that linezolid in the long term may cause an irreversible neuropathy, and that's one reason linezolid is not used for long-term purposes unless all other options are exhausted. Linezolid may also cause decrease in the platelet counts or thrombocytopenia, so CBC should be monitored while the patient is on linezolid. MRSA may also cause invasive, rapidly fatal infection or serious infections which require hospitalizations, such as MRSA pneumonia, MRSA skin soft tissue infection with bloodstream invasion and bloodstream infection, leading to a condition called sepsis, which needs immediate IV or intravenous antibiotics. The different intravenous antibiotic for different conditions of MRSA include vancomycin, which is the first line therapy, and second one that's commonly used is again linezolid. Other options include daptomycin and ceftaroline. Rarely, if a patient has hardware infection together with more superficial infection, then rifampin may be beneficial. But rifampin is never used alone. It's always used in combination with other anti-MRSA therapy. The different side effects that can occur with different antibiotics include thrombocytopenia with vancomycin, as well as renal failure. With linezolid, again, thrombocytopenia, neuropathy, and drug-to-drug interaction with some antidepressants and antipsychotic medications. With clindamycin, as we discussed earlier, C. diff is a side effect. Clindamycin rarely may also cause renal insufficiency. So if you see that a patient is on clindamycin and creatinine is going up, and uh, and there's no other medication that's causing it, so think about clindamycin. I have seen a couple of cases of clindamycin associated nephrotoxicity where the creatinine started coming down with after stopping the medicine. Ceftaroline is expensive, but is available as an alternative to vancomycin. Is used twice daily intravenously. Cubicin or daptomycin is also widely used in patients who have renal insufficiency, where we cannot, where we are trying to avoid vancomycin. But with daptomycin, we have to monitor a patient's CPK level, because sometimes it may cause rhabdomyolysis. You also have to look at the medication list before starting the patient on cubicin, because if the patient is on any kind of statins, there is higher risk for rhabdomyolysis. So either hold the statin while patient is on daptomycin, or we will have to monitor the CPK level during therapy. Cubicin may also rarely cause cough, shortness of breath, interstitial pneumonitis, etc. So if a patient's respiratory status gets worse, then in that case we have to think about daptomycin as a cause. So here we will end our discussion about the MRSA, and later on I will discuss in my different lectures about specific MRSA infections such as endocarditis or skin and soft tissue infections, osteomyelitis, etc. Thank you for listening to my lecture.